Population health, what that will give us and what it's given us in this 20-week programme is a real insight into the detail of what our residents are like in West Lancashire and what some of those issues are that they've got.
Our team has been looking at the local data around the Skelmersdale area, and they identified respiratory and in particular COPD being a real issue. We're also able to sort of dig a little bit deeper with the data and found that there was quite a large group of these patients with COPD had other comorbidities, for example diabetes and mental health issues.
We've tried to draw upon the knowledge and experience of all the staff who've been involved in this project to come up with a simple but yet very thorough pathway or a template.
But the template, the changes we've made to the template are looking more at the patient holistically, so looking more at the psychosocial aspects such as depression, anxiety, referring to social prescribing if it's needed. It's also providing them with more education about how to manage their exacerbations and ensuring that they're on the correct medication based on the latest evidence-based guidance.
Okay, so there's some good evidence nationally about group consultations and they seem to be effective, so we decided to adopt this pathway for the practice. We also use patient activation measures before the start of the groups to assess each patient's knowledge, skills and competence around diabetes, so we had a starting point to work from. We also use packs, so each patient got an individual pack with the results in, with a notebook to make notes and set individual goals, and just a little bit general healthy lifestyle information.
I think what working with the data and working as a group together has shown us is that it's possible to identify ways of having the best impact with our interventions. So we're still awaiting the outcomes of the work that we're doing, but it's looking quite promising. The template is pushing us towards gold standard management of COPD, and the group works are looking very much more at how to educate, inform, give people the tools to self-manage their COPD. So the two together, if we can target the right people for an intervention, use evidence-based medicine and then distribute that learning amongst patients and our colleagues, then that's got to be a good thing.
We currently have a team that looks at a lot of different aspects of respiratory care, and we've been able to identify a few gaps along the way, and which has led to the development of the template within general practice.
So what we plan to do is actually, we've got data for the whole of Skelmersdale at the moment. We plan to spread that out. We plan to deepen it in the GP practices that we're currently working with, and ask them to look a bit more at the population. We want to roll it out to the other practices in Skelmersdale, and we also want to try and bring in other partners.
In the first instance, in this project, only a couple of practices have been involved in the project itself. So our first opportunity is to widen the scope of this project. So take it to other practices in Skelmersdale as a start, and then all the other practices in West Lancs, as a next step.
It's given us the opportunity to work together in a way that we haven't before. The two separate projects that had been on the back burner for some time have come together and have really moved forward with the coming together of the action learning set. It's given us that opportunity to develop, and it's given us lots of ideas for the future of other things that we might want to look at, or other ways in which we might be able to target patients in the most effective way and the most meaningful way for the individual patient.
I'd say get involved. I think, there's no denying it demands a bit of time, and it's hard to find that time at the moment, but I think it's worth it. I think going through an accelerated learning approach really deepens understanding, really deepens a sense of a team, working with people that you ordinarily day to day haven't been working with. And I think ultimately it's an approach that allows you to really focus on cohorts of patients in the population where the greatest impact can be achieved, and that's impact for those patients most importantly, but also for your time as a clinician. And in terms of the efficiency and effectiveness of working with a broader church of people. So I'd say get involved, see what it's about, and see how it could really help change practice and outcomes for real people.